Listen, we're really glad you're here. We're going to get more straddlers coming in, but let's begin. Jessica's just going to introduce me. So, make the video's on. Those of you, does anyone here know someone with chronic fatigue syndrome, MS? What about fibro? Anybody here not know what fibromyalgia is? Okay, we're going to go through the definition. I'll go through it quickly, and then I'll explain to you how people get it and where it may be coming from. Then we'll be doing a free test on everyone here. Okay, but we're only going to take those with the worst problems. So if you've got problems, be honest. Tell us what you have, and we'll be testing you. The test will take about 4 or 5 minutes. Okay,
here we go.
The video's on. Okay.
Okay, so Dr. Lewis A. Kessel is the director of Kessel Wellness Center and has been serving the public as a chiropractor in the beautiful Murray Hill section of Manhattan for the past 25 years. He's a board-certified chiropractor and licensed to practice in New York, New Jersey, and Florida. Dr. Kessel is also a member of the International Chiropractic Association. In striving for excellence and to improve and constantly update his knowledge in the field of chiropractic and the related studies, Dr. Kessel, along with his staff, regularly attend postgraduate seminars. Dr. Kessel has helped thousands of pain sufferers, many of whom were once labeled as incurable, attain and maintain better health through his gentle yet effective advanced methods. His approach to optimal health is to detect, reduce, and prevent nervous system dysfunction, as chiropractic is based on the scientific fact that your nervous system controls the function of every cell, tissue, organ, and system of your body. And here's Dr. Kessel.
Thank you, Jessica. That was fast. Okay, well, welcome again. We had a class yesterday. It was very successful. We tested some people. There were some changes. We're going to look for something similar. Let me just tell you a little bit about myself. I've been in practice for 30 years, and lately I joined a group called the NRCT group, which is a nerve reduction testing group. There are 200 doctors throughout the country, only 200 doctors that are chiropractors that are doing this particular type of testing. It's very advanced. It was discovered in California, and it finally came to New York, and I've been part of this for almost a year. The one thing I want to mention real quickly is that people in the last 20 years have gotten a lot sicker. I should say people are sicker today than they were 20 years ago, and that's horrible. Here we are. We're in the wealthiest country in the world. So far, it's still wealthy. And we are one of the sickest in the world. We are 48th in longevity. There are 47 other countries that live longer than we do. We have most drugs, most hospitals, most doctors in the world, and yet we're one of the sickest. And it doesn't work. So today, obviously, we're trying to approach a natural way. I also belong to the Foundation of Wellness Professionals. This is a non-profit organization which which actually forces me to talk about 100 talks a year for free, as we are a natural wellness foundation. And it's my duty to do research, to talk to as many groups as possible. So if you belong to a group that you think might benefit from this, I have to tell you, I can't charge you a penny. And if you're interested in accepting that, let me know. Let Jessica know. She's my marketing person. Okay? We're going to begin with fibromyalgia, solutions of it. And let's go right into it. And I'm really glad you're here. So the next, there's some new solutions. I'm going to just skip this for a second. But I'm going to show you a video later on whose lives were changed within 4 or 5 minutes. But let's talk a little bit about fibromyalgia. Let's take a look at the word fibro. It's a fiber or fibrous. The word myo comes from the word muscle. It comes from myo, which means muscle. Algos is pain, and IA is a condition of or state of pain. So the whole thing is fibromyalgia. Interestingly enough, women get it more than anyone else. 80% of women between 40 and 60 years old. We don't know why exactly, but I imagine. Okay. I imagine there's a reason for it. I think we have some ideas after you see this talk. Next part is that it's just simple. The fibro means simply a condition which is characterized by pain in about 11 different areas in your body. And this pain was this pain that was categorized by medical doctors. They say they couldn't figure out what it is, so they said, okay, if you have 11 areas of pain up to 18 or so, then you have fibromyalgia. According to Dr. Frederick Wolf, he said basically that a lot of people actually just use fibromyalgia as a wastebasket. They just say, okay, you wouldn't know what it is. It's fibromyalgia. And so here's some of the symptoms. If you know anyone or if you have some of these symptoms, and if you are really bad, we will test you today. And insomnia. How many people here have problems sleeping? Okay, at least more than once a week. Okay, that's not good. Fatigue, emotional instability, depression, irritability, nervousness, and anxiety. I know. You see, it's interesting. How about just headaches? How about headaches more than one a week? Okay, that's not a good symptom. I'm not going to brag about this, but I haven't had a headache in 20 years since my divorce. That's the last time I had a headache. Trigeminal neuralgia, that's with TMJ problems. All of these things are muscle spasms that are created in your body. IBS, let's go on. Calcium deposit under the skin, rashes, rectal and vaginal pain, and communication problems, and severe block to low back and hip pain. We can go on and on. We have a testimonial. I'm not sure if we're going to have time to show it. There's one woman who has what we call the chronic syndrome of she can't control her arm. And that goes all into this category also. So if you have one or more of these symptoms, or if you have one symptom more than once a week, then there is a signal going on in your body that needs to be handled. And that's what we're trying to do today, is that handling of it. If you're interested, we'll talk to Jessica, and she'll sign you up for it. How many people here, if they knew they can get rid of a problem today, and it would be affordable, and you can get rid of it, would want to look into it? Okay, terrific. Okay, so after this talk, if you're interested, see Jessica. How could fibromyalgia or other neurological conditions cause these symptoms? Well, the meningeal compression, this is the new thing. We were looking at, can I just have that spine? The meninges are, thank you, inside the spinal column, there's a spinal cord. It's surrounded by meninges. There's 3 layers of it. And these meninges go into the nerve roots. So when you have a compression or constriction of the meninges, it affects all the nerve roots, one way or another. And therefore, you can have a problem here that's affecting your toe, or your intestines, or your large intestines. In chiropractic, and because I'm a Wellness Foundation consultant and a chiropractor, we look at these things very seriously. Okay, let me get this out of the way too. How many people have been to a chiropractor here? Okay. Look, there are good and bad in lawyers, accountants, and there are good and bad chiropractors. We're good. We've been doing this for 30 years. Before I was a chiropractor, I was a physics and math major. I'm very scientific. We're very caring and very thorough. So we look at these things. It's a new research that we've just done. Let's take a look at what the meninges look like. Here we go. Look at this. This is the outer layer. It's like a cord. Think of it as a cord of a wire. And you go into another layer, there's a middle layer, and then finally on the bottom layer you can see blood vessels, nerves. And notice this is the spinal cord, and look at this, it goes into a nerve. See where it goes into a nerve? So if this is twisted right in here, or constricted, it can travel to wherever that nerve is, and if that nerve is going to your hand, it might cause carpal tunnel, or numbness. If it goes down to your foot, or to your large intestines, it could cause constipation, diarrhea. It's amazing. Wherever that nerve root goes is where your problem is going to be. So in the past, when we've tested people, we noticed that all of a sudden their foot circulation improves just by touching their neck. Meningeal compression is very dangerous. And when the neck or skull are out of alignment, it could pull on the meninges. When the meninges are pulled, all the nerves can be pulled. The nerve roots control everything in your body, okay? And meningeal compression, pulling on the meninges, can cause amazing things. You may not even think about this. For example, it also can tell the body to do things that it should not do, like secrete adrenaline or tighten your muscles. Or it could set off the sympathetic nerves and can cause IBS. It can also cause, the same thing can change the brain chemistry, and so people take antidepressants. We've had patients who actually improved their mood, irritability within 2 or 3 minutes. This could also make your joints hurt, make you anxious, give you back, feet or hand pain, and flood your brain, and so many impulses that can cause fogginess of your brain. Finally, meningeal compression. This affects your cranial nerves. And when you affect your cranial nerves, it affects your eyes, your ears, and your taste, as well as speech. And if we have a chance to see this, you'll notice some people can't even speak well. In fact, if you have a fibromyalgia, you speak too much. You just keep talking and talking. You can't focus. And that's been slowed down. Okay, some of the causes. How do you get this? How do you disturb the compression in your meninges? Well, physical trauma, surgery, whiplash, genetic predisposition, lupus, rheumatoid arthritis, neurological pain caused by mental stress, and cancer. Sometimes we think that a person who has fibromyalgia, we think he's drunk. They're just so out of tune. They look like they're slurring their words, and we misdiagnose them as being drunk, or MS, or Lyme's disease, or just faking it. What could add to neurological pain? Well, there's been some physical therapy, stress, exertion. How do we reduce it? Well, taking a walk, massage sometimes help, laughing, better nutrition. This is called the Neurological Relief Center's technique. And this is what we're going to be doing, testing today. Jessica's actually collecting some of these tests right now. I should say the questionnaires. And we're going to look for the worst person first. Neurological Relief Centers, this office is involved in research. We're doing research at this moment throughout the country with this group. And so if those of you who feel this can benefit them, you'll be part of the research team. To reduce the meningeal compression, we will demonstrate in a few minutes how this is done. Of course, I have a feeling a lot of you want to do this today, and we won't have time to do it with everybody. But I will tell you this. If we don't have the time today, come to the office and do it in the office, which is, by the way, on 33rd Street and 3rd Avenue. We're not too far away. We'll be testing immediately. You will be called in order of sickest first. If you test well, we will schedule you an appointment to finish up your exam, if you're interested. Please, no talking during the testing. However, when I'm testing, you can come around and watch. This is a possibility to change your life. So we're going to do that, but let me show you some testimonials first. We have about 10 minutes. Would you like to see them first? Or just do the testing? Just do it. What?
We have no time. You have to leave in 20 minutes.
Okay, I have to check. Okay, I'm going to show you.
We don't have sound. We don't have sound.
Let me sit down. Okay, let me just check it out. All right. All right. Jessica says Jessica basically feels we shouldn't do it right now. If I could just show you one testimonial, it'd be great. I think. Here we go. I'm going to just show you one of my patients. Okay. Jessica, you know what? Maybe we can open this table up meanwhile. Okay, here's a patient. This is a person who came to me last year, right here, in this room. And let's see if we can get her in here. Okay, notice the chairs behind her. These are the same chairs. So this was done right here. I never met her before. She came for a test. And let's see what she has to say. This is before the test.
I was diagnosed about 20 years ago with chronic fatigue syndrome. So debilitated and consumable. No matter what I tried, nothing was working. I have seen doctors.
Her head shaking.
Healers. I have seen all.
She's had fibro for about 18 years.
And now, when I developed for some years now terrible neck issues, I found it very difficult for me to eat my next.
I see smoke going on.
It's really,
Everybody see that?
yeah, it's a major problem for me. And very fatiguing too. I have to continuously keep lying down because of the fatigue, and it's very difficult. Sitting doesn't help. I have to lie down. And I have developed a disorder where I can't swallow.
She developed a
I've been
disorder.
eating my food for the last 10 years.
She can't swallow.
And I have seen people for that, and nobody can help me. I also cannot tolerate anything. I cannot tolerate vitamins.
She can't take vitamins?
I
I've
have
had
not
an
even
aspirin
had
20 years.
aspirin for the last 20 years. That's where I've lived. I only eat a handful of organic foods.
Okay, here she is. 4 minutes later.
The pressure, I felt enormous pressure in my body, and it seems to have lightened.
Doesn't feel the
Feels like
pressure.
I could almost go dancing.
Aww, that's great.
And then we have more of her. As she progressed, she came to the office, she kept progressing better and better and better. Okay, that's all we're going to show. Jessica's right. We have to finish up this thing right now. Unfortunately, we're not too much. We have like 2 hours work of stuff here, and we don't have time for that to show you. So now we're going to begin the testing. Jessica, you got to give me somebody really in trouble, okay? Okay, we're going to need a volunteer. So you're giving me.
No, I'm doing it the opposite way, but she filled out the other way.
I thought,
Okay.
yeah, I'm sorry.
Okay, I got you. Okay. Okay, everyone hear what she has? A little tremor in the hand, uncontrollable tremor in the hands.
Yeah,
Little Bell's palsy on the left side.
yeah. 2000, I had a antibiotic reaction that stopped the blood going through my brain, so I had low blood pressure.
When was that again?
2007, so I had low
So
blood
for
pressure.
3 years, her circulation has stopped.
Yeah.
Okay, go on your back.
So that's been the
Okay.
worst.
Okay,
Oops, maybe I should take this off.
okay.
To make it easier.
Let me take this off.
Now put this down on the floor.
Just make sure it's comfortable, okay? Is it comfortable? Okay. And if anything's going on, let me know. Okay? That's good. Good. Next relaxed, totally relaxed. She's very relaxed. She really wants to get help. And we're just looking for a little improvement. Not a million degrees, just a little bit to see if she's in the right direction. Tell me anything going on?
I feel more pressure, more stuff on the left side where I have a lot of the...
Okay, she feels more pressure on the left side, where all the problems are.
Yeah.
That's where her compression is.
A big knot in there.
She feels a big knot in the left side. Anything now?
It's easing up a bit in the left side.
The left side's easing up. Move your hand around, the left hand. Okay. Yeah. Okay, now relax again. Good. Usually, in my testing, the worse the symptoms, the better the results. And we're going to end it up in a minute or two. Anything, feel any warmth, cold, anything?
Before I was feeling kind of like my whole body is kind of like a string that had been plucked, you know, and now it doesn't feel, it feels like my nerves are calming down a bit.
Okay, everybody here? Her nerves are calming down. She felt stringy or like strings attached. It's loosening up. Okay, we're going to get you up, and we don't have the time, but tell us a little bit what's going on.
It does feel a bit better. I'm shaky in specific spots, but it didn't quite feel so shaky all over the place. The shooting pain felt originally kind of like an elephant was sitting on my face, and now it feels lighter. Definitely feels lighter. I feel less shaky now. So that was helpful.
Okay, so that's within 2 or 3 minutes we're able to reduce some of the things. Your hand is still shaking. This is something. This would be a great challenge. We would see how this works in the office. I've seen involuntary arm motion going away, and anything with focus, mental, anything like that.
I feel a little clearer. I feel like I can speak better than I was earlier. So, and sometimes the brain fog is really bad to the point where just my mind is thinking, but the muscles just don't want to go anywhere.
Yeah.
And, yeah.
Okay, thank you so much. Okay, thank you. You did a great job. All right, we're going to wrap it up. So thank you for listening. And those are the kind of cases I would normally take. Again, like I said, the worse the problem, the better the results. And I want to thank everyone who's been coming to me. And then Jessica, you want to say a few words? Okay.
Who would like to come in? I have some appointments. Who would like to come in for a testing and consultation, complimentary?